Hi, I'm Dr. Sian Cole, and this video is discussing a few myths about seeing a psychologist. And I hope I can bust some of these today. So, myth number one, only crazy people see psychologists. And look, this is just not true. And I don't really like to use the term crazy, even if people are struggling with depression, anxiety, or other mental health issues. So, really, most people will have some level of emotional distress in their lifetime. Life does serve us up challenging situations. So, the fact is, asking for help is probably the most sane thing anyone really can do. So, having a psychologist that can actually help give you an outside perspective to those tricky, challenging situations can be really helpful. We definitely go and see professionals to help us when we're in physical pain. So, how about seeing people if we're in emotional pain? Myth number two, if you don't start feeling better right away, it's not working. Yes, sometimes in therapy, it does get worse before it gets better. And this is because you're discussing your problem out loud and not trying to numb or avoid, which is tend to what we do as humans. We might use unhelpful and unhealthy coping strategies such as alcohol, drugs, food, sleep, distraction, TV, social media. So, seeing a psychologist, you have to face what your challenges are, which can create more unpleasant thoughts and feelings. So, seeing a psychologist, you do have to talk about these and face up to them. But once you do this and then learn some effective, helpful coping strategies, you will then start to feel better. Therapy doesn't cure people of unpleasant thoughts and feelings, but it does teach you ways to manage them. Myth number three, I don't need a therapist. I have family and friends that can do the same job. Well, I'm glad people do have support networks, and sometimes all you do need is to have a chat with family and friends. But sometimes there are problems and challenging situations that do warrant a therapist. And this could be for a number of reasons. One is that maybe the family or friends are actually causing the problem. Another one is that they're not subjective either. For example, if you're wanting to break up in a relationship, but the other person might not really have an objective stance on that. So, talking to a therapist, depending on the problem, is not necessarily the same as what a family or friends can do. Plus, they've also got training in recognizing mental health problems, understanding the relationship between thoughts, feelings, and behaviors. And that's kind of what we need to understand sometimes. Also, sometimes it's not fair to put extra pressure or strains on your relationships. So, seeing a therapist means that you can talk to a professional who can hold that rather than putting it on a friend or a family member. Myth number four, therapists only want to talk about your childhood. Well, I have to say, the way that I work is very much in the here and now. My main type of therapy is acceptance and commitment therapy, which is about what's challenging you now and looking at how you're acting and what your thoughts and feelings are doing to hold you back. Though sometimes it can definitely be important to look at your family of origin to understand what you've been through and any traumas. But most of the time, we want to help you in your here and now life. There are types of therapy that do focus on your childhood, but you talk to your therapist about that's where you want to do. But I definitely have to say it's not the only thing that we want to talk about. Myth number five, medications do the same job as a therapist. Now, medications can be very important and can really help people manage some debilitating symptoms, but they don't necessarily resolve the core of the problem. You can think of medication as a bit of like a band-aid. It can actually help cover and protect the wound from further damage. But if you don't really know what the original cause was, it could come back. For example, people might be using an antidepressant to help deal with the symptoms of grief. But if we actually don't deal with the grief and loss, then that need for the antidepressant can definitely be maintained rather than learning how to actually handle that grief and then be able to come off the antidepressant. At times, actually, medication and therapy can work as a great team. Medication without therapy can sometimes cause a dependency on medications. And this is why it is a good idea, especially if you're medicating for grief and loss, that you see a therapist to actually learn how to manage and hold that grief and loss. Myth number 6, therapists give advice. Now, I do have to say this comes up a lot. I have a lot of people who ask me on their advice, and I do actually let them know that I don't give advice. If they do really want it, I'm happy to give it, but I let them make their own decisions and I hold it all very lightly. Now, that might be different to kind of maybe giving some psychoeducation around mental health, thoughts, feelings, actions, health conditions, things like that. For example, might help people learn how to manage their low mood or get a good night's sleep or how to communicate more effectively. But I'm not going to give people any personal advice, like if they should stay or leave a relationship. I'll help them have the tools to make that decision themselves. Another really common myth is therapy is endless. And I think, when therapy did first start off with the psychoanalysis work with Freud, which now is over 100 years ago, it was an ongoing thing for that type of therapy. But these days we've come a lot further. We do things much more like cognitive behavioral therapy, motivational interviewing, solution focused therapy. That therapy is not going to go on forever. Most times people see a therapist for about 10 to 20 sessions and then might come back for a booster session here and there, depending on what's happening in their life at that stage. Myth number 8, therapists only listen. Therapy is passive. I think this myth also comes again from that kind of psychoanalytic type therapy where therapists would be quiet, be a blank page. However, that's not what we do. We have a much more active approach, teaching people skills and strategies and self-awareness. Definitely, we do active listening and we'll use silence at times, but we do a lot more than just listen. Myth number 9, therapists are perfect and do not have their own problems. Well, that's just impossible because therapists are human too. So we have a full range of our own problems and emotions. And I think it's useful that I've lived life myself and that it gives me perspective on what it's like to go through grief or trauma or challenging situations. So I can actually understand what other people are going through. So therapy is about becoming self-aware and accepting responsibility for our actions. And really, who would want a therapist that's not willing to do this for themselves? Myth 10, therapy cures people from feeling unpleasant emotions. Now, I think I brought this up a little bit earlier in one of the other myths, and yeah, this just doesn't happen. Unpleasant emotions tend to occur in unpleasant situations, and there's just no avoiding that in life. We might help people through a rough patch in their life, but it's not going to cure people from feeling sad or anxious or trauma or grief in the future. But the hope is that people have better coping strategies that are more effective for them and they feel more able to cope. That's kind of what we're really hoping for when you see a psychologist, wanting to help people not feel so overwhelmed by their unpleasant emotions. And last myth, myth number 11, therapists are all that new agey, warm fuzzy, you're good enough, smart enough, cheerleader types. So I would agree that most therapists are encouraging and empathetic, and we definitely do want to have a warm, supportive environment, but certainly not all therapy works this way. I can be quite challenging with my patients, but I'm trying to balance that with comfort. You don't want somebody who's just challenging you, and you don't want somebody who's just giving you comfort, because then you're not going to be able to, face, those difficult challenges that you might have been avoiding. So it's more about having that balance. As well, and that can be through education, as well as challenging people's self-talk or some of their avoidance behaviors, things like that. So that comes to the end of the most common myths I see in regards to people thinking about seeing a psychologist. Thanks for listening.